being hosted by the USAID-funded Higher Education System Strengthening Activity. The project is being implemented by the University of Utah in collaboration with the University of Alabama and the International Institute for Education, Washington, D.C. We work with 16 public sector universities across Pakistan in a bid to strengthen systems so that we can, hopefully improve quality of higher education on these campuses, and with that improve the employability of graduating students. This webinar today is the first in a series of webinars that the HESA project is putting together for everyone. The topic for today's webinar is mental health and well-being in higher education. Today also happens to be the World Mental Health Day. We know that mental health is not a new issue. It's been an issue, persistent issue on higher education campuses for as long as I can remember. And we know that COVID-related issues, COVID-related closures only exacerbated the problem. Unfortunately, it also looks like the problem is not going away anytime soon. So I think this makes this a very timely, very relevant conversation. And I'm hoping that in today's webinar, we don't just discuss the issues, but also talk about maybe, some things that the campuses have already gotten right. And then also identify places where the higher education campuses can, further strengthen themselves to help their students better. We have a great panel here today. And I really appreciate you all being here today with us. I am going to introduce the panel shortly, but before that, just to set the ground rules for the participants. The participants, of course, will keep their mics and video cameras off at all times. We will take questions from you towards the end of the conversation, perhaps in the last 10 to 15 minutes. So if you have any questions, please type them up in the chat window down below, and we will get to them as soon as we can. And with that, I would like to introduce our panel. We have with us Dr. Noreen Akhtar. She is the Deputy Director and Senior Psychologist with the Center for Counseling and Career Advisory at the National University for Science and Technology, NUST. We have with us Samina Uzair. She's the Student Counselor and Clinical Psychologist, Lahore College for Women University. We have Ahmed Ali, who's the Clinical Psychologist and Wellness Counselor at the Institute of Business Administration, IBA, Karachi. We have Dr. Daniel Inouye. He's a certified adult psychiatrist. And by the way, he's also the focal person who works on helping us support the 16 partner universities in bettering their wellness centers. So welcome, Daniel. Great to have you. Natalie Humphrey, she has joined us she's the head of student experience and well-being, and she has joined us all the way from the University of Birmingham in Dubai. And Natalie has a lot of experience, not just working in Dubai, but also in the UK. So it will be great to hear about, some of those perspectives from different places around the globe. So once again, welcome everyone. I'm going to jump right into the questions. And my very first question, and if Dr. Noreen, you can, could perhaps take the first question first. Because I know that the National University of Science and Technology has been offering mental health and wellness services for at least 14 years. So my question to you is, if you can tell us a little bit about the patterns that you see in the issues that the students bring to you. That is the first part of my question. And then the second part of the question is, do you see any differences in the patterns or in the issues that students bring to you now versus, let's say, maybe 6 or 10 years ago? Noreen, are you still there with us?
Yeah, sorry, am I audible?
Yes, you are.
Okay, thank you, Aisha, for giving me this opportunity to talk about this issue. And I am associated with this profession from past more than 15 years, and I am working with these young adults from past 14 years. So yeah, there is a huge difference. I could relate to my experience once I joined back university in 2009. But precisely, I'll talk about mainly two or three things. First, if I recall, once I joined university back in 2009, people were so reluctant while coming to a counseling center and talking to a mental health professionals. I mean, we had to put a lot of effort in raising this awareness that it's okay to talk about your issues. Maybe because of fear of being stigmatized, people never wanted to talk to a psychologist or an issue. After the hard work of good, I would say 14 years, now people come to us. Now students come to us by the word of their mouth. I mean, they're self-referred, so they don't feel enough, maybe stigmatized or fear of being stigmatized. But I won't say that this fear is now over at my campus. We are still struggling with this. I mean, we are struggling, and we are conducting, various regular orientation session, awareness raising session with our freshmen, sophomores, and graduating students. And separately, we conduct these kind of sessions with our faculty, officers, and the junior staff. Yes, the patterns have been changed a lot. I mean, one thing which I have noticed is that now the young students are becoming more vocal about their issues. I mean, they are very much self-aware. Once there was a time they used to come to visit a psychologist, and they used to report that probably they are not even aware, or then they don't know what actually is happening to them. But now they're more aware, they're more vocal about it. If they come to the counseling session, they used to Google their symptoms, so they used to have a good vocabulary of psychological terms. So at times, as a counselor, it becomes difficult for me to counsel them and to guide them. At times, I always ask them to please not Google your symptoms. It's not going to help you. But if I talk about, if you ask me to enlist the main issues which probably the students is reporting, it's more or less same. But yes, nowadays people are more about their self image in terms of their social media image and their reality life, and then low self concept, which ultimately leads to several other issues. For example, low self confidence, which also leads to at times anxiety, depression, relationship issues, and then adjustment issue would be the one of the toppest among the freshmen. So yeah, I think I have answered my question.
Thank you, Doreen. I mean, that was very, very helpful. Sabina, I'll come to you next. And I would pose the same question to you. I think your experience or your perspective is an interesting one, because you deal with an all women's campus. So in your experience, would you agree with most of what Noreen has already said, or is your experience any different?
First of all, thank you so much, the HESA team, the USAID, and Dr. Aisha for choosing me as a panelist for this conversation, for this webinar. Yes, I agree with Dr. Noreen for, yes, there's problems are, problems are same in some sort. But in my case, I will see a huge difference in the nature of problems that is upcoming to me. Yes, in beginning, in Lahore College for Women University is the first university to establish the counseling center in public sector. So in 2006, they have established a counseling center, and we have a team of psychologists over there. But yes, in beginning, people are very reluctant to approach the counseling center. I agree with Dr. Noreen on it, because a huge part and a huge effort was put in to aware the people to come into the counseling center and to avail the facility. But now, if I go into the deeper that regarding the women issues, I see the change in the student, that most of the students are reporting cyberbullying. They are telling, they are reporting the abuse more comfortably as compared to the past. Many students came to me and they know that this information is confidential, and they report abuse, and we deal with it very with confidentiality, and all the intervention has provided to them. And the one issue is very common now. The students are more open to talk about the relationship issues. Previously, in the women university, students are not open to talk about their interest in the other sex, and they are not open to talk about their sexuality. But now students are more open towards it, and take it as a problem to them that they need to discuss. What are the boundaries they need to develop, and they discuss these kind of issues comfortably with the psychologist. And the anger, which I have seen that previously, I have seen that people think that anger is not the issue that they bring up to the psychologist. Now they consider it that anger will lead to the mental health illnesses and mental health issues later on. So we need to take it seriously, and that change I have observed in my university. And I have done a lot of work on it, because previously when I post an ad on anger management workshop, very less people are interested in it. But now I see that people come to me and say that we want anger management workshop, and how we can betterly regulate our emotion. So that's change I can see in my campus. Thank you.
Wow, thank you. I mean, that was very insightful. Natalie, I'll come to you next. And then again, the same question, but from your perspective, in your experience, what patterns do you see in your students?
Hi, thank you. Yeah, so I've only been at the University of Birmingham, Dubai for the past year. So in terms of your question over sort of like the long time, what have I seen changes for, I'd reference when I was working for universities in London. And I would say the major change that I saw in my role, which is not a clinical role, is the willingness of students to not only come forward to seek support for their mental health, but to seek adjustments in their teaching and assessment as well for their mental health. So accepting a diagnosis, a long-term diagnosis, which would then provide them access to support as a disabled student, which was quite a significant change. And particularly with those, what we would call in sort of like the UK terminology, sort of like that tier 1 entry level mental health. So quite low level anxiety, depression, maybe stress related disorders as well, where students would be willing to seek longer term support rather than a shorter period of maybe counselling support, which might last for 6 to 8 sessions. I would say in Dubai over the past year, what I've seen a significant change in is willingness to come forward. That might be because our team has grown, and that saying, if you build it, people will come. So in building a wellbeing and mental health team within the Dubai University and on the Dubai campus, we have seen more students come forward to seek support. So whereas before students would have had to have gone to our team in the UK to seek support, now that we're here and on campus, we've seen a significant increase in the number of students who are coming forward to seek support. One of the barriers to support for our students that we are still seeing, which hasn't changed over the year, is an unwillingness to take support outside of the university, because within Dubai, where we work on health insurance systems, if a student is under their parents' health insurance, it would essentially disclose what health or mental health reasons the student is seeking support for to the parents. So we often find that once we have exhausted all of the support available within university, students aren't willing to then continue on with that support outside of our systems. Thank you.
Thank you so much, Natalie. And with that, Daniel, I'll come to you. And if you can answer the same question from, where you're coming from.
Yeah, so in terms of campuses I've worked with, I think the key challenges we're seeing are very similar in the United States as they are and from what I'm hearing from in Pakistan and Dubai. Anxiety, depression, adjustment disorders, relationship problems. These college students are feeling isolated, especially those that didn't get the typical freshman experience because of COVID. In terms of what we're doing, I think the biggest change we've seen over the past 5 years is campus leadership is seeing it as a truly critical issue. They're making mental health a campus-wide priority. It's starting now when kids apply to school. The colleges are making students aware what services are available because they know it actually is a selling point of the university. Students want mental health treatment. Students after acceptance before the first day of school are getting screened. They're screening for the disorders. Orientation, mental health is a big part of orientation, making sure students know that they're not alone and that services are available, whether it be text lines or the crisis center. things of that nature. Dormitories and residence halls are being made aware. Faculty are getting more involved. Faculty are being trained to monitor their students. If they see a sudden drop off of student performance, they're being trained to reach out to a centralized sort of leadership group who will be receiving reports from different parts of the university. So if multiple faculty are saying, we're seeing this big drop in performance for this particular student, the university can actually reach out to the student and ask, hey, what's going on? How can we support and assist you? We're seeing peer counseling, micro-counseling, workshops. Of course, universities in America pretty much all have counseling centers, and that is helpful as well. I think universities are also starting to see extracurriculars as being part of the solution, helping students feel more connected to each other. And also now we're seeing a lot more formal policies put in place to support students that have mental health needs. So I think that's the biggest change that we're seeing, is it's becoming more of a campus-wide priority.
Great. Thank you so much. And Ahmed, I know I told you that I'll come to you in the next couple of questions, but I think you're the only one left. And if there's anything in addition to what everyone else has already said, please go ahead.
Okay, so I think I'm audible. Okay. So I think things are covered, but few things I will add here, that people are more open to talk about their problems as compared to past, and they are trying to destigmatize the issues which has been seen as a stigma in the society. So there is a prominent change as we compared from the past. So yeah, we are dealing with orientation of new students about mental health problems, particularly academic issues. Like they have reported different kind of issues like academic issues, transition phase, adjustment issues, stress, anxiety, depression, homesickness, substance abuse, and many more. But if we talk about the recent things, especially in Pakistan, students presenting complaints, some of the reported have been changed, from the past. It's due to pandemic and also economic crisis and political unrest in the country. So yeah, students face financial crisis. That is a big stressor for them. That affects their academic activities, both mental health. So yeah, I feel that some of the issues have changed from the past. I think many of the issues have covered from the other panelists. That's from my side.
Thank you so much, Ahmed. And a number of you have touched on a number of things that I really want to talk about. And for some of those, I will come back to you in the next few questions. But almost all of you also talked about, how, still to some degree, talking about your mental health is creates a little bit of a discomfort on part of the students. It's always difficult for them to walk into a counselor's office and say that I have a mental health issue. I know Natalie talked about, that increasing the size of the staff has helped to make them more accessible to your students. What are some of the other things that you have done to dispel this, stigma perception around the issue of mental health? So 2 or 3 concrete things that each campus has done to make your students more comfortable coming to you. Noreen, I can.
Thank you, Aisha. Since I just mentioned that it was a long struggle for, making them feeling comfortable, like it's okay at times, it's okay not to feel okay. So, it's not that easy. And I always appreciate whenever a student visits to a center, and because it's a bold step. It's really a courageous step to talk to a psychologist and acknowledging that you're going through psychological issues. In NUST, what we have done, we have formulated an advisory system. And this advisory system is handed over to the faculty members of each department and school. So what we do on the basis of the task sharing, what we do, we have trained most of our faculty members with the basic counseling skills, so that initially student can talk to their advisors if they have any psychological issues. So we actually at center, what we have done, we have enabled our faculty member how to provide a first aid psychological services. If the student is visiting them, at their space, what are the do's and what are the don'ts, which they actually need to follow, and what is the red lines, what is the red flags, and how to identify those red flags so that they can refer them to the psychologist. And I think this is very effective because, it's since if I talk about my institute, we are total 5 in number, and it's really impossible to capture the needs of each and every student. So it is actually, capturing the needs of the maximum students. And secondly, students are becoming more comfortable through the, through a process. I mean, first they talk to the advisor, and most of the time they need just a person who can listen to them and who can, just take their information confidentially. So at times, most of the problems are resolved once they are listened. So if the problems are not listened, then they refer to us. And I think this is one of the efficient system which still so far we have established here at NUST. And I would like to know from others' point of view also. Thank you.
Thank you very much, Noreen. That was very useful. Natalie, is there something that you would like to add in addition to what you've already told us?
Yeah. So one of the initiatives that we introduced recently was what we call our UB Well Library. So it's an area of the library that has been designed specifically with well-being in mind. It's got lots of books which talk about well-being and mental health that students can take and use to support themselves, with self-led support and resources that they can access. We also have QR codes that they can access the library online. The point being that students can see that it's out, it's on display. We have floating staff who will go and spend time in or around the library and talk to students conversationally about well-being and mental health and other topic areas. As somebody mentioned, for example, substance use and isolation. So we've got books that reference that, so we can talk to students about that. We trained our student reps on the same system that we have trained our staff, which is recognise and refer. So it's a system where, and I think Noreen just touched on it, where people can recognise signs and symptoms and refer students on for the correct support, but also have that initial conversation. We don't expect anyone to treat, counsel or advise students who are not in where that isn't their role, but we do expect that everybody is able to have that initial conversation that then enables signposting, and that staff and student reps or students who have any sort of responsibility within the campus feel comfortable having that initial conversation. So we've done a lot of work around that and the recognise and refer system. And then the final thing I would say that we have done is, and I think Dan touched on this, is that we've been very, very visible during induction week and welcome week, so that students know who we are and feel comfortable to approach us. So they've repeatedly heard that message. And then we've asked all of our academics to also invite us to at least one teaching session per programme, so that students are reminded of it, because we can often find it in induction week, they get information overload. And they might not want to hear about what could go wrong and if things are not working for you, where to seek help. So we make sure that we go back in and repeat that message of a little way into the term. Thank you.
Thank you. I mean, those are some really concrete and very doable steps to some of them. Just a small follow-up question, Natalie, to that. Do students access these self-help materials?
Yes, so we found students sitting there in the UB Well Library and accessing the materials, having a read through them. We do have psychology as one of our really big pathways, so a lot of the psychology students do go in there and read it. But it has been a conduit for a couple of students to seek support. So they've been sat in there, a member of staff's come along just to say hi, and the student has said, I'm reading about this because I'm actually experiencing this. So we need to, and this is a good point, Aisha, we need to take some more concrete data as to how many students are using it and then seeking support. But it is a well-used part of the library, and it's frequented quite regularly by students. Also, I think because we've put some nice furniture in there to make it look cozy and welcoming as well.
Great, thank you so much. Thank you. Samina, I'll come to you with the same question. 2 concrete things that you have done to make sure that students are more comfortable approaching you.
Okay, my approach to eradicate the stigmatization is a little bit different, because I try to aware my students and faculty members that mental health illness is the one part, and prevention, the social skills training, and the prevention part is another, the well-being part is another part, and we can coordinate with teachers to promote social skills in the students that will further enhance the basically well-being in the student. And for that purpose, we have introduced a term of mental hygiene in the students to make them aware that how they can keep their mental hygiene intact in their daily life, and what are the short techniques to do them. And it really helped to basically destigmatize. But still, I feel in the public sector campus that the faculty is more feel stigmatized as compared to the students to approach to the mental health counselor. In terms of that, they have, I feel that they have more confidentiality issues, and we are working on that. For that purpose, we are designed that we are going to approach the faculty step by step, department by department, to destigmatize these mental health concerns. Thank you.
Thank you so much. Dan, my question to you, and we tend to, and not because we don't know any better, but just because, it's, it's easier to have the conversation that way. But the student body is a very diverse body, right? So even on a campus, the total student population has many subpopulations. If you can talk a little bit about, whether you see certain student populations struggling more or feeling more discomfort accessing counseling services, and if there's steps that you've taken to remedy some of that.
Well, that's actually a really good point. There definitely are some students who are much more eager and willing to get services, and there are those who find it a little bit more difficult. I don't have exact data on this, but my perception is that in the United States, students who come from more liberal areas, from more urban areas, are often much more willing to get those services, whereas those who come from conservative, religious, or rural backgrounds are sometimes a little bit less eager to receive services. One of the big things that we do, and one of our big messages for students, is that mental health issues can happen to anyone, and it's not a moral failing. And that is one of the things that we want to reach out to students to make sure that they're aware. Because that feeling that there's something wrong with you is actually something that can prevent people from getting help. So our big message is, it can happen to anyone. It can happen to you. It's okay. This is just part of life. It's a medical issue like any other medical issue, and we're here to provide you support and services.
Thank you so much. Thank you. And Ahmed, I'll come to you in just a bit with the next question. I think somebody already has already touched on the fact that, our campuses are always facing resource constraint. There's, even now, even though campuses are more aware of, the necessity of providing these wellness services to students, these are on many campuses still treated as, auxiliary services, and not, as main as your academic support that you provide to students. So, and that obviously has an impact on the scale and the quality of services that you're able to provide to your students. It's also maybe not as realistic to expect that all campuses will be able to provide, services to such a diverse student body at that kind of scale. So what are some of the ways in which campuses can address that issue? You can never have a counseling center that's big enough, or hire staff that's, that caters to all kinds of issues, or on the scale that we are talking about. So are there solutions available? Are there partnerships, for example? We know that there are telehealth services, and those emerged especially during the COVID closures. So Ahmed, my question is to you. Is this something that you have dealt with on your campus?
Yes, Dr. Aisha, we have developed a good referral system for severe cases, those who are in crisis and need emergency treatment, like the cases which are very severe. For that, we have signed MOU with Aga Khan University Hospital, Karachi, for psychiatric OPD weekly. So one of the psychiatrists from AKU visit a wellness center of IBA we have developed, and to do clinics free of charge for those students, faculties, and staff who are having some severe mental health issues and need psychotropic medication for immediate help. So yeah, IBA was working in collaboration with other online platform also due to resource constraint to provide telecounseling services during COVID time. But it ended and it was a good experience with them. Yeah, I can appreciate that we should develop online platform to enhance our resources. So yeah, in IBA, for more complex issues or those that require high level of care, students are provided with professional referral outside the campus. If someone is in a state of psychological crisis or one needs an emergency care on campus or hostel, particularly if a person feels that he or she might hurt or endanger themselves or another person. In that case, we refer the person to higher care and emergency treatment to AKU. So yeah, crisis management team inform the wellness center of IBA for immediate action. So we refer them to emergency treatment to Aga Khan University Hospital, which is providing a psychiatric emergency service with proper rehabilitation treatment. So yeah, it has been fantastic, and students, faculties, and staff are satisfied availing these services.
Thank you very much. I'm sorry, did I cut you off?
Yeah. That's all from my side.
Thank you so much. Natalie, is this something that you've tried on your campus? Outside partnerships, tele services?
Yeah, so we are fortunate that we are considered another school of the University of Birmingham in the UK. So we do benefit from some of their partnerships. So we have 2 counselling providers who provide text-based, phone-based and online counselling services. We have one that does sort of, I don't like calling it low level because none of it's low level to the person, but low level mental health concerns such as anxiety, depression, adjustment disorder. Then we have another service who provides support for students who we think need more of an intervention and might have more clinical based diagnoses such as eating disorders, those who may be feeling suicidal or experiencing suicidal ideation. So we have a different service that we use for those students, and both of those are partnerships with outside providers, because we found that we just didn't have, we could, as you said, Aisha, to use your own words, you can never employ enough people to work on campus. In country, in Dubai, we've also just partnered with 2 of our local mental health therapeutic centres and counselling centres, and they have a network of psychiatrists, psychologists, counsellors across the region. And so if they can't support one of our students, then they can reach out on our behalf to that network to see if there is somebody who would be able to support a student. For example, somebody who might be experiencing mental health difficulties following issues related to any sort of abuse or sexual violence, which is a very might be quite specialist, then we can refer to one of those. And we find that those systems are working really well. In the UK, universities are now partnering much more closely with the NHS, which is the public health body over there. I was working for UCL, who are based in a London borough of Camden, and we were able to refer students directly into that NHS service, which worked very well. Obviously, in Dubai, we're unable to do that with the private sector. But yeah, so those partnerships I find work incredibly well. They do take some relationship building because you have to build that trust and know that you're going to have that response. But when it works well, it can be of great benefit to the students.
Great, thank you. Daniel, is there anything that you would like to add? I'm really interested in learning more about, and not just me, I'm hoping that the audience is also interested in learning more about, teleservices. Do you have experience with those working on campus, and how has that worked out?
For telehealth services?
Yes.
I think telehealth services have been a great boom for many many campuses and many students on campuses. It's made connecting with the university and the mental health centers much more easy and much more private. It's taken away a lot of the barriers that we previously saw. The idea of having to walk to a certain part of the university where everybody knows there's the mental health center, people don't have to do that anymore. They can set an appointment online, and they can attend these appointments online, and they can even go to these appointments sometimes when they go back home for the weekend. I think it's been a tremendous success. That said, I do think there's also a paradigm shift that needs to occur, and I don't think it's occurred even in high resource countries at this time. The fact of the matter is there is far more demand for mental health services than there is supply. You look at the best staffed university counseling centers, students that are high risk will be able to see counselors more often. But if you were to look at the averages, maybe a student would be able to see a counselor maybe once a month. And to make meaningful change, that might not be enough. And so I think over time we need to start looking at mental health as more of a campus-wide priority, where students help one another, faculty help one another, where people receive treatment from the counseling center, but there are other forms of treatment that don't require a license that you can get from people that are closer to you, small groups, building connections between peers. I think that's where we need to be headed.
Okay, and then that's actually a nice segue into the next question that I wanted to ask. And maybe if you think you have anything more, maybe you can build on what you've already said. So I've heard about this certain campuses taking this public health approach to mental well-being. What is that about? Is that the same thing?
If you think about the public health approach, the great success in the United States was with smoking. We went from people smoking on average 4,000 cigarettes a year to now it's less than 1,000. So at one point we viewed smoking as a moral failing, something that was a choice. It's all about willpower. And that didn't work. And so we had to change how we looked at it. We no longer think about smoking as a moral failing. We think about smoking or mental health issues in these campuses as being something that can happen to anyone. This can happen to your child no matter how they were raised. So we want treatment to be available for everyone, both rich and poor. So we are finding ways to provide treatments that have no or low cost, and we're making them available to everyone. We're having broad awareness campaigns. The other day I was in Germany and I looked at a package of cigarettes that they were selling, and there's this big picture that shows like what smoking can do to your body. It's this idea that this can happen to anyone. So we have universal policies, we have universal screening. There's even some universities who are doing almost like universal treatment. They are saying these are high-risk times for students. Let's break them into small groups. Let's get them into support groups during this high-risk time. A lot of these kids don't have a mental health issue right now. Let's make sure that we can keep them doing well. And those small groups that they're putting them into are being helpful for both the students that have no mental health issues and those that do have mental health issues. So that's the approach that we're seeing some take, and I think that approach is working. It goes from a mindset of treatment to a mindset of prevention.
Great, thank you so much. And Natalie, I'll come to you next. And my next question builds on what you said in your response to the first question. You talked about students coming up to you for longer term adjustments, and that, if I understand it correctly, means working very closely with other departments or faculties on campus, making sure that that some of those problems are resolved. Can you talk a little bit about taking that campus community approach to making sure that students feel well and get the service that they're required to do better academically?
Yeah, so we are, so students who are seeking long-term support, we class them rightly or wrongly as disabled students. So they fall under the remit of support of a disabled student, which means putting in place reasonable adjustments so that they can access teaching and learning in a way that they can be successful. So we, and I guess to help explain why that would work, it's looking at students who experience long-term mental health difficulties as neurodiverse, and they're approaching their learning in a different way. So we know that examinations are essentially a test of your ability to recall. So a student who might experience, and I'm very much generalizing here, if a student is experiencing anxiety, we might provide them with strategies to cope in an exam and strategies to be self-resourceful in an exam, but they may need to take rest breaks, they may need to take slightly longer to be able to enact those strategies. And so that's what we do in terms of reasonable adjustments. And the same with same with in-class teaching. Group work is another good example where we might put in place reasonable adjustments to help a student build up. And reasonable adjustments are not about ever removing the need to do something. It's about giving students the tools to access the task that we're asking them to do. That does take a big culture shift in terms of working with your academic departments to get them to understand why we're putting in place reasonable adjustments, and to understand it's not about making things easier, it's about making things accessible and inclusive for all students. In terms of a campus-wide approach, lots of our speakers have already spoke about this, and it's about it's a whole campus responsibility, and its well-being and preventative measures are a whole campus responsibility. So that is something that we do through induction, through staff training, through campaigns that we're running throughout the university. Days like today, World Mental Health Day, making that a big campus-wide initiative and activity is really important, and our programs like our Recognise and Refer program. Another thing that we're doing this year is training staff and student leaders to be mental health first aiders. Again, it's about sharing the responsibility. It's not just about the wellbeing practitioners or the mental health or the counsellors or the mental health advisors. It's everybody's responsibility to take that approach and to support students' mental health.
Thank you, Natalie. And Noreen, I'll come to you next. And is this a direction that Pakistan campuses, or at least your campus, also now starting to take? Is mental well-being, or like Natalie said, there are certain students or certain issues for which the campus has to work as a community, and there needs to be a paradigm shift. Is this something that we are seeing on our campuses yet, or are we not there yet?
Yeah, I think this is very relevant in a way that we are actually struggling with, I would say, with the basic needs of hiring, or having a counseling setup at universities. If we have, for example, in our campus, yes, we do have. So this can be planned, and this is planning in our center, but I guess this is not applicable to every university in Pakistan. What Natalie just said, that I mean, there is a need to have community approach in targeting various psychological issues. For example, if I talk about certain targeted population, for example, luckily there is no as such ethnic or a prejudice sort of a groups in our culture. But if we talk about if specifically I talk about the Balochistan campus, NUST Balochistan campus, we are struggling with this ethnicity issue. So we need to have this kind of a support groups, and we are trying to train our students, we are trying to train our faculty to be more sensitized about those issues. So yeah, I think since currently we have also established another committee, and I being the member of that committee, is the protection against the transgenders. I mean, I think in our country, these are the population which is highly harassed by each one. I mean, no matter if they are male harasser. At times they are harassed by females, at times they're harassed by males. So we are trying to create such small community groups. I would name them as a support group to provide support, and a psychologist from our team would be facilitator and be a leader to support certain kind of issues that targeted groups or probably the community group, probably small community groups are having. So the role of a psychologist is to facilitate the process of adjustments. So yeah, I think this is very important to have this kind of a paradigm shift in each of the university. But I would say in Pakistan's universities are struggling. I mean, very well-known universities in Pakistan, they don't have a psychological counseling setups. So it's preliminary. It's important to have those setups, and then we can definitely. There is need to for this paradigm shift, and we are, in fact, in our campus, we are trying to do so.
Great. And I'm also cognizant of time. I know that some of you have a hard stop at 7. So I'll just quickly try to go through the next 2 questions because I think they're important, and then we can take a couple of questions from the participants. And for this, I'll come to you, Samina. So if I were a faculty member, what are 2 things that I can do? It can be 3 too. So 2 or 3 things that, if I go to the classroom tomorrow, I can do to ensure that my students feel that sense of belongingness or the sense of care that is important to allay, some of the mild symptoms that students face, stress, anxiety, those kinds of things. So what are your top 2-3 things?
Yes, it's a very good question, Aisha. I will approach your question in a way that we should train our faculty members, encourage our faculty members to aware them that they are the very important factor to enhance the well-being of the student. If they think that they are the social supporters, in psychology, the social support is a very essential element to prevent mental disorders and enhance well-being. So we can train our teachers on this regard, that they have the basic counseling skills of being active listening and reflect on the student problems. And as we already have discussed, if we have guided the teachers about the mental health indicators, so they can very well align with them. So they can execute that basic counseling skills of being non-judgmental, reflective upon the student problems. They will really help the students with mild issues to resolve by themselves, because we, as we have said, it can happen to everyone. Mental health is for everyone, and we daily we face stresses in daily life. And if we see it is as a human nature component, every human being is a problem solver. So we have to just enhance and capacitate the teachers in the problem solving skills, so they can disseminate that kind of skills in the students, and it really helps to eradicate the mild symptoms. Okay. And we also can establish the referral system betterly. And also we can design some surveys and some systems.
I'm sorry, Samina, I'm looking at time. I'm sorry, I need to just, I just want to make sure.
Okay.
Thank you very much. That was very comprehensive.
Okay.
Emma, two things that faculty can, if I'm a faculty member, I can say tomorrow to my classroom. You're muted.
Sure. So yeah, it's necessary to treat the students fairly, politely, by active listening and genuineness. Sometimes, look, active listening and building trust resolves many issues. And for complex issues, as we have already discussed, that faculty need mental health gatekeeper trainings. Gatekeeper trainings are programs are designed to enhance an individual ability to recognize the sign of emotional distress in other people and refer them to appropriate resource, such as the wellness center. So if they are not trained enough to identify the issues in students and they have no skills, so they can breach their confidentiality and privacy also. So in this way, things will be worst. So when faculty members share their own experience about struggles, failures like success and coping strategies, it fosters a climate that supports mental well-being also. So students consider their faculty as a role model to learn from them, and they learn how to cope with challenges and recognize that seeking help is a sign of strength. So yeah, I have read about some of the programs of international universities also that encourage faculty to speak out about failures, resilience, and success also. So in this way, students will be more open and motivated to share their problems and create insight that challenges and setbacks are normal part of life and rigorous education. So yes, faculty members can deal with mild symptoms very carefully and cautiously.
Okay, thank you so much. Natalie, two things.
I would second what Ahmed said about, you know, talking openly about mental health in the classroom and well-being in the classroom is incredibly important in terms of destigmatizing. And I also think embedding mental health and well-being into the curriculum, so doing a project that tackles mental health and well-being, there is no subject where you can't bring it in into some sort of project, essay, assignment, group project. So I would encourage all academics to do that in terms of classroom-based activity to help create the conversation and also destigmatize some of what students might be feeling.
That's actually a great suggestion, and I know that the HESA project is trying to do some some of that integration in the work that they do with the universities. Dan, is there something that you would like to add to it?
Sure. I think if there's one thing I think a faculty member can do, it's to care. Care about the students and realize that's part of your role. And you know, there's a saying to make you should make the implicit explicit and the explicit experiential. So a lot of students, they've never heard their teacher say to them in front of the class, I care about what's going on in your life. I care about more than just this coursework. I want to know what's going on, and I want to know how I can help you. And even fewer have had the experience of a teacher taking them aside and saying, hey, what's going on? I know that you got a bad grade on the test. I don't care about the test. What's going on in life? You know, just having that feeling of someone caring about you has a transformative effect. Schoolwork will improve, I promise. Care about the students and you'll see the results.
Thank you so much. And I think that's a great note to...
Can I interrupt?
Go ahead.
In fact, everybody has given a wonderful input in teachers' suggestion how they can, you know, be a full resource in, you know, dealing with these psychological issues. In fact, since we are in the process of training our faculty member, one thing which I have encountered, or maybe which I have come across, is that keeping the confidentiality of the client, that matters more. If the students is, you know, aware that their information is going to be remain confidential, they feel really secure. Rest, all of the participants have explained that, you know, being genuine or be more emotionally available and, you know, be more, you know, supportive to them, that is actually supporting. But maintaining the confidentiality, for example, if once I have shared information about student who was at risk for self-harm, and I called the advisor of that student, and the second day the student visited my office, that everybody knows in my department that I am, you know, taking psychiatric medication. So I think this needs to be more catered off. I mean, in terms of teacher needs to be trained in terms of maintaining the confidentiality of the information of the clients. If they are maintaining it, I think rest of the problems are resolved by themselves, because at times they just need a listening person. And if they have sense that their information is not going to be misused, mostly the problems are solved at the teacher's end. Thank you.
Yes, I would
Thank
definitely
you
agree with Dr.
very
Nadeem
much.
on it.
I mean, this has been a very
because
insightful
the word
conversation.
trained, basically, we have to approach through a trained channel. Not every teacher can do that the next day, but we can train and we can set an advisory system in the departments to avail this facility.
Sure. Thank you, Zamina. So here I would like to, because we have 6 more minutes and I can see at least 6-7 questions in the chat window. But thank you so much, everyone, because this has been, I'm pretty sure, very, very helpful and very informative for all of us who were listening to you. There are actually 3 or 4 different listeners who have asked pretty much the same question, just in different words. And the question is, what are some of the signs and flags that faculty members should look for to identify students that are in need of well-being support? And here I do want to acknowledge my very able, very helpful colleague, Asma Mohsin from the IIE, who's been taking questions from the audience and typing in a direct message window to me. So thank you very much, Asma. You have been a great support. Who would like to take this question? 2 or 3 red signs, flags that faculty members should look for.
I think I can take this question. The basic red flags is a decline in the performance of the student, absentees, large number of absentees in the student, no active participation from the student side, and the mood variations, and how attentive the student is in the class to connect with the teacher and other class fellows. And I think the evaluative system should also somehow consider that if we can see that there is a change in the mood and the evaluation of the students, so we can, these are the basically red flags. Changes in the mood and decline in the performance can be the big red flags.
Thank you, Samina. I would like to ask Natalie the same question, and then maybe Dan.
I would agree with Samina in terms of absenteeism. So absence, isolation from the group could be very, I suppose it's just differences in behaviour, because some students are isolated from the group, some will be very engaged. So changes in behaviour. And I would, if I think of another one, absenteeism, I would also say the decline in performance, or asking for things like extensions. So asking for repeated extensions. I think that's the important thing. 1 extension is fine. 3 is a red flag.
Okay, and then I'll ask you a different question, because this is I keep getting this question. So the question is, what do you think? What do you suggest are the key priority areas of capacity building interventions on which the higher education system strengthening project should focus? Interventions that will have multiplier effects.
My opinion on this is it's the most important places, I think, where you're going to see multiplier effect is in student interconnectivity. I know it's easier in some ways to think about setting up a counseling center, but I think student interconnectivity is where you are going to see exponential growth. Even if it's just setting up extracurricular sports, for example, at a university, places where the kids can talk to the other kids, where college students talk to other college students and they build the relationships. I think that is the single greatest place where you're going to see multiplier effects.
Wow, that's helpful. Natalie, anything you would like to add?
I would absolutely 100, not just second what Dan said, 100 it. So we have just introduced student groups, clubs and societies to our campus, and it's made a huge difference to students. And I think staff talking, staff engaging, encouraging students to do things outside of study is incredibly important, because often we find it's the drive to study that then can lead, and it stops being, can be a causation effect. So staff talking about well-being, encouraging students to do stuff about it, and putting in place things for students to do.
Great. There's one other question, and I think we have 2 minutes to get through it. What do you do with issues that the university cannot really help students with? So for instance, there are people who have asked what to do if the student is stressed about financial issues, for example. What do you do with something like that? And there are quite a few students who are always stressed about, financial issues, especially in the economic situation these days. How do you deal with something like that? Noreen, would you like to? It's a difficult question, but.
In fact, thank you, Aisha. In fact, we have a proper system developed here, which comes under the University and Advancement Office. That they take care of all the scholarships, at times need-based scholarships, and there are multiple scholarships available. And at times, definitely, they're not that much that we are going to cater the 100% of the students available. But for example, most of the students, if the student reports to me that he or she is currently going through the financial constraint, and because of this, he cannot concentrate on the the studies, there is a referral system. I would talk to the University Advancement Office, and what they do, they talk to, there are separate alumni groups of every department and every school. So what the alumni, at times they have their own charity system. So at times the donor adopt the students for partially or maybe the full reimbursement, full scholarships. So there are a lot of scholarships, and I think it's equally available to each of the universities. All the things which university needs to do is to streamline the different national level opportunities. At times there are national level opportunities, at times there are provincial opportunities, and at times there are international opportunities also. So our the scholarship office look after all these things, and our career counselor, she is the one who actually guides us that where are the certain scholarships can be, are available, and I guide and counselor guide those students to those outlets.
Thank you so much. I mean, you've answered it perfectly. I know, Natalie, that you had to leave at 7 sharp, but before you go, one question or one thing that we haven't talked about or that campuses are not talking about, but should be talking about in terms of mental health and well-being support.
I'm glad that we've brought up finances, because that is an important one, and I saw it in the chat as well. I think everybody has the opportunity to become a vulnerable adult. It's, mental health and well-being is transient for many different reasons. There's sexuality, substance use, health can cause mental health issues and difficulties in people, estranged students, so students who do not have a family or support network. So I think that one of the things that we need to think about is the idea that everybody could become a vulnerable adult, and there are loads of different intersectionalities of that. I think Nori mentioned about having support groups. So yeah, I prefer the concept of vulnerable adult as something that we need to consider and have those preventative things in place. So if we talk about finance, have things ready for somebody. Like, I work in Dubai, everybody says nobody in Dubai is going to become financially unstable. They may become financially unstable, so let's have those things in place for it. That goes back to the idea about being that at any point any one of us can become a vulnerable adult, and we need to consider that.
Thank you so much, Natalie, and feel free to jump off if you need to. Thank you so much.
Thank you very much. I do. It's my son's birthday. Lovely speaking to you all.
Happy birthday to you. Happy birthday to you.
Taking part in the webinar. It's been really fantastic, and happy to answer any questions afterwards by email.
Hope we will get a chance next time to talk and discuss our case studies.
We will. We'll have another session. Thank you so much, Natalie. Feel free to go. Thank you so much. Thank you. So I'll just take another minute, and for everyone, Dan, if I know it's really early at your end, so if you want to go next and then maybe jump off, one question or one thing that campuses should be thinking about, and they're not yet thinking about it.
I think the one thing that campuses should be thinking about that they're not thinking about right now is how do we organize our students into communities? I think there is some thinking about it. I'll be honest, there is some thinking about it. I wish, but I think we're not thinking about it enough. How do we organize our students into communities and groups where people can be connected to one another and support each other?
Thank you so much. Thank you. And again, feel free to jump off. It's 7 already. I'll just go through the. Thank you very much, Dan. And Samina, anything you would like to add to that?
I think the universities should think about the higher ranks, their mental health, what kind of issues they are facing, and prepare them for the mental readiness towards this very important issue. Because if we see it from the other lens, it is the barrier towards the social emotional learning, and in return it reduce the employability, which is a very common issue in Pakistan, the economic crisis and all that issue. So the higher authority should consider it as a very, very important component, as well as in the students' lives, as well as in their own lives also. So we can move towards a better society and a part of a big community.
Thank you so much. Thank you, Samina. Ahmed, would you like to go next?
I think things have been done already, but I will add some one point here. We need to still destigmatize the stigma in the society and make it more open by having some sort of designing manuals or programs to shatter the myths and stigma which students have, and they are more not easily approached to us on wellness center due to this stigma. So yeah, we have to plan some sort of, like, we have to design a manual or some sort of program, advanced program with in collaboration with HISA. So, and in this way that we need to just destigmatize the mental health issues in higher education.
Thank you. Thank you very much. Thank you, Ahmed. Noreen?
I think each one of the points has already been discussed previously. One thing, in fact, and I would comment two things here. First is that mostly the universities in Pakistani setup is what they're trying to establish their center by utilizing their own faculty member, which is really not a great idea, because initially you need to hire a trained person who can establish the center, or maybe a wellness being, or whatever you called it, and then further maybe you can involve faculty member maybe in terms of your support. And secondly, for those universities, as they're well developed and nourished universities, I would say there should be some programs to take care. There's to take care of the mental health of the psychological staff also. I'm talking about a psychologist at times, because at times literally I feel myself literally drained, that I'm out of the resources. I need a little break. But there is for example, right now, it's the peak of the time, it's a peak of the stress, and we can take off maybe for a day. It's a huge, so I think there should be some sort of relaxation time, or maybe the higher education should be thinking about it, just to relax us for not maybe days.
Yeah, a couple of months may not be possible, but I think a couple of days is fair. No,
Yeah.
I think that's really important. So, I mean, I don't have enough words to thank all of you. This has gone exceptionally well. I think this was very, very insightful, especially for somebody like me, and I'm sure several others on the call right now, who may or may not be wellness staff members. But I think this is a topic which is, I mean, you can't really cover it in an hour's time. So we will hopefully have follow-up sessions. We'll try to engage more speakers, try to take more questions, and talk about things that we have not been able to cover in this conversation. But thank you so very much, Noreen, Samina, Ahmed, three very capable speakers, three very capable campuses among our partner institutions. I will share the recording once we have downloaded and looked at it. But thank you very much for being here. Can't thank you enough.
Thank you for giving this an opportunity. Thank you.
Thank you, Dr. Isha.
Thank you.
Yes, thank you so much,
Thank you,
Aisha.
everyone.